Knowing your team.
It is important to know your healthcare team as you are going through treatment. Diagnosing and treating cancer is often complex. Patients may often require the help of several different medical professionals. With many specialists on your team, it can be very difficult to understand each person's role. Not all specialists are at every hospital or treatment facility, and additionally, they may go by different names, share names, and/or responsibilities. Therefore, it is very important to identify the specialists you will be working with, as well as their job titles and responsibilities. First is your oncologist. The oncologist is the doctor who specializes in diagnosing and treating cancer. When treating cancer, it is advantageous to align yourself, if possible, with an oncologist who specializes in your specific cancer. Being a specialist means they exclusively treat patients with your cancer, for example, multiple myeloma. Your oncologist oversees your care from diagnosis throughout the course of the disease. They will become your primary doctor. The oncology nurse may also be known as the oncology nurse navigator. Oncology nurse navigators serve in many roles depending on their experience, advanced education, and specialized certification. This person will likely be by your side the majority of the time that you're on the site at the hospital or treatment center. They offer education and resources to facilitate informed decision making and access to quality health and psychosocial care throughout all phases of the cancer continuum. The responsibilities of the oncology nurse may include giving physical examinations, administering chemotherapy and other medications, identifying patient needs, coordinating with other members of the team, educating and counseling patients and families, and performing research as part of a clinical trial. There's also the oncology nurse practitioner, or NPs. NPs usually meet with patients independently while collaborating with the rest of the oncology team. They are always under the supervision of an oncologist. The responsibilities of the NP may include performing physical examinations and patient evaluation, diagnosing and treating certain conditions, recommending diagnostic and laboratory tests, and reading the results, prescribing medications, giving chemotherapy, helping patients manage cancer and treatment side effects. Educating and counseling people about cancer and their medications is also part of their responsibilities. Performing certain procedures and performing research as part of the clinical trial. The patient financial navigator may also be known as the financial patient advocate or patient navigator. There may or may not be one of these professionals available at your facility. Don't hesitate to ask. If they are not available, there are outside cancer organizations or private organizations available, such as the American Cancer Society and the Patient Advocate Foundation. It's important to remember that navigators are unbiased and help you work to find the best health plan for your needs. This individual may guide patients from diagnosis through survivorship. Their responsibilities may include assisting a person in finding counseling and assisting in finding financial resources and other support services. Palliative care doctors and nurses. The palliative care teams work closely with other oncology team members to prevent and treat the symptoms and side effects of cancer and its treatment. A palliative care doctor is especially helpful when a person is still experiencing pain and other symptoms despite treatment for these symptoms. The physician assistant or PA. A PA works with a doctor delivering a broad range of services. The responsibilities of the PA may include performing physical examinations, recommending diagnostic and laboratory tests, and reading results, as well as helping with surgery, managing cancer and treatment side effects, prescribing medications, and administering chemotherapy. Educating and counseling people about cancer and performing certain procedures are also part of their responsibilities. Oncology social workers are usually assigned to you upon entering a hospital or a treatment facility. These specialized clinicians can help you cope with every part of your cancer journey, from understanding the diagnosis and treatment plan to navigating financial, social, and emotional issues, to assisting patients transitioning back to work and regular activities during or after treatment. You can also ask your social worker to connect you with available resources to help with financial challenges and help you navigate the unique resources available to your hospital or treatment center. Oncology resources specialists. Not all facilities have these professionals, but it never hurts to ask. The oncology resource specialist can answer questions regarding transportation options for patients, as well as local lodging for patients and their families during treatment. They will also help navigate other resources we will discuss, including government and organizational support. The registered dietitian. also known as an RD, provides education on eating well and provides recommendations to help people with cancer cope with dietary needs. You may find during your treatment that your appetite has changed. These are great resources to rely on during that time. Rehabilitation therapists, such as physical, occupational, speech, or recreational therapists. These professionals help people with cancer return to their highest level of functioning. Patient billing or hospital financial services. Please remember that the hospital won't refuse to treat you if you don't pay your bill right away. However, your account should be in good standing. A payment plan can have many benefits, including discounts on the total amount you owe. Many hospitals have billing departments that will meet with you and set up a plan that works well for your individual circumstances. Some even offer meetings with a financial counselor who will work closely with you on your insurance, cost obligations, and identify the right resources for you.